So, how do you treat bunions? And with a problem that's mainly genetic, treating is more like how do I stop the progression? How do I stop the progression of this head coming out this way, the first metatarsal head? And this is a normal foot, of course, and that big toe drifting over and, of course, pushing out like that. Some of the easier things we can do are, believe it or not, are arch supports. Now, a functional orthotic, the ones we make in the office that are casted, sent to a laboratory, they'll actually pull the arch up and they'll put you in more of a locked position, which is a neutral or supinated position, because people that pronate, they tend to jam and the toe drifts over faster. So that's how we can treat a bunion where it will stop its progression, maybe stop rubbing as much. There are toe spacers you can purchase over the counter, online stores like Amazon, or some of these Velcro straps that pull them over. I've heard of several treatments with Botox. I'm not sure about that one, to paralyze one of the muscles. But to try and drag the toe back over that's naturally pushing over with all the force of the body coming down, because that's torque, force times lever arm pushing off that area. Usually to treat those ends up into surgical repair. And surgical repair is a little bit more difficult because unless it's just a little bit of a shave job from the bump itself, most of the time we're swinging the head over on a procedure further back in the foot, or just moving the head back over towards the second toe and drifting the toe away from the big toe away from the second toe. Those, of course, involve an osteotomy, which is a bone fracture. And treatment of that will take about 3 weeks of non-weight bearing. There are some people that allow weight bearing, different literature you can use, because we have what's called a stable osteotomy that doesn't really move, like Lego that snaps into the foot, and we'll put a screw, pin, or things of that nature. But being non-weight bearing for 3 weeks is usually your best bet on letting this heal more thoroughly and faster. After that, there's some physical therapy. A lot of my patients, I'll still follow them up with the orthotics because it does take the pressure into the arch up here and suspends the big toe joint, which is right here, topping it back here. So once you have the right pair, and if you get over the counters, make sure, of course, that the device stops behind the big toe joint, because if the orthotic goes to the end, it'll push it up. So those are the main treatment options that are out there. There are some other things to stop the progression inside the shoe, but of that nature, it's just basically a silicone shield. It looks like kind of a half eggshell, and you can place it right on top. Or there's a round donut that'll put the pressure around the bump. Of course, that's what I tell my patients if they've got to go to church or go out for a nice evening that's temporary. 1 or 2 times I'll inject right under the skin, because right at the top of the bunion, right here on the inside of the foot, is a nerve and a vessel. So this nerve gets pinched against the shoe, and sometimes a little bit of cortisone can calm it down and get them through an event. Otherwise, it's mainly a surgical correction. If you want to talk about that, there's more that has to be discussed at the office, take x-rays, things of that nature.